As part of the ADHD assessment, we look at trauma. So children who unfortunately are affected by adverse childhood experience, they might go through a different process of development. I usually explain this to parents that if you imagine the brain of your child is like a garden with the soil and the seed there as the nature, and that is the genetics of the child that you give it to your child, then as a gardener, you are providing the nurture and helping that garden to flourish and helping the best plants to come out of the garden. But if you imagine there is a cold climate coming for a year, or the unwanted weeds coming from the other sides of the garden, and the garden is not growing enough, then basically as a gardener, you are trying to protect the garden and helping the flourishing of the plants. So that is your role as a parent, as a carer for your child, and also helping your child to achieve that potentials by a mix of psychology therapy, medication, input from their education and school, rather than that cycle goes worse and worse and worse and the garden shrink and shrink and shrink. So this is very important part about trauma, adverse childhood experience, and then the impact of that in presenting as neurodiversity symptoms.